Hello, I'm Paul Zollinger-Read, the Chief Medical Officer, and we're launching the e-learning module for shared decision making. This has gone live in the UK today, and in December it will go live everywhere, and it will be in Polish, Spanish, Cantonese and Mandarin. So what is shared decision making? Well, in any consultation with a patient and a clinician, there are two experts. There's the clinician, who's an expert on the medical stuff, and then there's you, the patient, and you're an expert on your own preferences, your own wishes. And it takes both of those coming together to get a great outcome. The evidence is really clear. We've done pilots in Chile and Hong Kong, and from that we've learned that 90% of people going through this, so 90% of our customers, feel more empowered about moving forward with the treatment once they've been through a shared decision-making process. We also know from other research that the clinical outcomes are improved if you go through a shared decision-making process. So that whole process of understanding the benefits and the risk can significantly improve not only your satisfaction but your clinical outcomes. For a long time I was a GP and I've used shared decision-making on many occasions. The most obvious one is someone facing an operation like a hip replacement, and you would sit down with that individual and you would explain the risks of a hip replacement and the benefits. Likewise, the risks and the benefits of just having physiotherapy and the risks of the benefits of just staying on medical treatment, on drug treatment. And then once those discussions have happened, the patient can think and go home and talk with their loved ones about what's right for them. I've also used shared decision making in more difficult and challenging circumstances. So for instance, a lady with a family history of breast cancer who is suffering from terrible hot flushes and has to make the decision, is HRT right for her? When we know that HRT can increase your risk of cancer. And sitting down and explaining the risks and the benefits and enabling that person to make an informed decision. And the lady I'm thinking of went on to use HRT. There was an increased risk, but it really transformed her life. She could sleep, she felt better, she felt more confident, and we monitored her closely. So folks, I've just done it, and I've got a certificate to show that I've taken part in the e-learning shared decision-making module. So whether you're English speaking, whether you're Cantonese speaking, Mandarin speaking, Spanish or Polish, this is for you. It's also for everyone. It's not just for clinicians, because shared decision making is important to everyone. Putting the other person at the center of the conversation and having an informed conversation. So please go online, look at it and learn.